jumping into is Gage is going to continue telling us about
Mhm.
medical school and the
Yeah.
wonders of that. And that's why we named this episode Medical School. When does it all end? So I'll
Yeah. So
allow.
last time we talked up to medical school, right? Like I talked about the MCAT and all that kind of stuff.
Right.
So now we have to assume that you've taken the MCAT, you've done well, grades, you got it, all that stuff is taken care of, and you've applied. Um, I think I talked about the application process for medical school last time, so we'll just assume you've been accepted
Mhm.
up, you've been accepted into medical school at this
Right. And
point.
you said you applied to 30 or 40
Yeah,
different
with the
schools.
expectation that you won't get invited or interviews at all of them.
Mhm.
But the more you apply to, the more interviews you're going to get. With the downside of it's going to cost you more money.
Right.
Um, so we'll assume you've been accepted into medical school. And I can talk about, my experience where I went to medical school and all that kind of stuff. But as a
Right.
general overview, there are two different types of, I don't know how to describe medical doctors, I guess, two different types of doctors.
Like the
Most people are
DO.
familiar with the MD, the
Right.
medical doctor. I'm actually DO, which is the other version. Um, for all intents and purposes, there's no difference. We all do the
Mhm.
same thing. The training is roughly the same.
Right.
So
And,
once you pick one,
and
go
now
ahead.
you're and now MD medical doctor, DO, it's doctor of osteopathic, is that right?
Yeah. So
Osteo.
MDs are allopathic doctors. We're osteopathic doctors. It's supposed to be more like holistic, I guess, a whole body approach. I don't know that that's actually true, but
It's still Western medicine.
yeah, still, oh yeah, yeah,
Yeah.
very much so.
Right. Right.
So you can pick either one, um, but once you do, the application process is the same. So once you get to I can only speak to my experience at an osteopathic school, but the MD school is going to be roughly the same. So it's 4 years, right? So it's the same amount of time as undergrad. The split is 2 and 2. So your first 2 years is all classroom work, well, mostly classroom work, where you take you do biochemistry, anatomy, physiology, all the general stuff you would do, pharmacy, all that kind of stuff that you need to learn basic knowledge. Some of it's basic first year, and then you would build on it your second year, so you're ready to go into the hospital. Um, but the first couple years are pretty eye opening for a lot of people. Um, I think I don't remember, maybe a couple weeks into my first year, we took a quiz. It was worth like 6 points or something, but I studied for like 3 hours.
Oh my
And
gosh.
I was like, oh my God, this is not, this is what I have to do for the next, well, for
Forever.
the rest of my life, but at least 2 years. Uh, so I knew then that it was not going to be, because for a lot, like I talked last episode, a lot of people can coast. A lot of doctors are smart enough they can coast through college. Some of them are smart enough to coast through med school, but those are like the elite, very few. But most
Right.
of us, when you get there, you're like, oh my God, you're not ready for this.
Hmm.
It's a lot more hours than medical or than college, so you're taking more classes, you're doing more stuff. The content is not necessarily harder; it's more the volume. It's just a whole bunch of volume at the same time because you're taking all these classes that was on biochem, anatomy, phys, anatomy lab, all this stuff you're taking at the same time. It's not broken down. Um, so
It's
for me,
difficult.
the volume was very tough um, to adapt to. But
Hmm.
essentially, what happens is you do the first. It's broken down into semesters like college is, but you do 4 semesters, so 2 years, um, where you learn the basics, uh, basic medicine, all that kind of stuff, and then once you finish the 2 years, you go in. The second 2 years, depending on who you are, might be better. I'm not a huge. We can get into it at some point, but I'm not a huge clinician, which is one of the reasons I chose radiology. But the last 2 years are the clinical years of your medical school. So the first year and a half ish is kind of um, what's the word, like laid
Didactic.
out for you. Yeah.
Okay.
So
Okay.
it's they're set. So you have to do internal medicine, you have to do peds, you have to do OB, you have to do family medicine. Like you don't get the pick. You have to do those
Mm.
core rotations, and
Yeah.
then there's some electives built in. So once you get into like the end of your third year, you're like, okay, I'm starting to think I want to do radiology. I want to do one that's not, if you want to do something that's not one of the core, radiology is not a core rotation. So I had to do an elective. If you want to do, most surgery rotations are just general surgery. So if you want to do plastics or orthopedics or neurosurgery, you have to take an elective. So the first part of your third year
Does that
is
add
laid
on to your
out.
now? Does that add on to your time gauge? Like if you're going to take
No.
elective?
So it's all built in.
Okay.
So the core rotations you do first, and then
Mhm.
they give you time at the end to pick your electives to do whatever you want to
Okay.
do. And you can also take your electives in things that you've already done. So if you know you want to do internal medicine, then you take an elective in maybe either internal medicine or one of its subspecialties like cardiology or GI or
Okay.
whatever.
So
Um,
if you're family medicine, if you know, okay, I want to go family medicine, you could take,
yeah,
you already took your regular class in family medicine or whatever that is, and now
yeah,
you're taking an elective more
hmm
into being a family medicine doctor or
yep.
whatever. Okay. Okay, I
So you
got
either
you.
get more exposure into family medicine or you get exposure into other things to make sure you don't want to
Right.
do it. Like family medicine is what you want to do.
Gotcha.
Um, I knew I knew about 5 minutes into I think I started with internal medicine and
Okay.
I started outpatient. So we started in a clinic
Hmm.
and it was 5 minutes into my first, um, like history and physical. And I was like, I cannot do this. So I
It's
knew
not.
immediately I didn't want to do any kind of clinical medicine,
Yeah.
which eliminates everything for the most part except what I chose and
Yeah.
pathology. Pathologists they don't do clinical medicine either.
Right.
Um, so once I figured that out, it's getting down the road, but radiology was an easy choice once I figured that out.
Yeah. Yeah. Yeah.
Um, so like I said, the first 2 years clinical or preclinical and then clinical. There's also some exams along the way. Doctors get tested a lot. So not exams like the quiz I was telling you about. Everybody has those
Hmm.
as well. But there's three what they call step exams. The first one is called step one. They're all just numbered. But step one, which you take after I think it's after your second year.
Hmm.
So you've learned all of your preclinical stuff, and now you have to go take an exam. So when I went through that exam, in large part dictated what specialty you could go into. So if you didn't score very well, you weren't going to go into a competitive subspecialty, which is usually like your surgical subspecialties are very competitive.
Hmm.
When I went through, radiology was competitive, anesthesiology, stuff like that is more competitive, whereas stuff like family medicine, peds is not as competitive.
Hmm.
Um, so most people study 6-ish months, like dedicated studying for 6 months.
Hmm.
And then you take that in the summer before you start the clinical years. So assuming you do well on step one, that opens a lot of doors that wouldn't otherwise be open if you don't score. And it can make up for a lot. So if you have poor, because you get graded on everything. So if you have poor, like clinical scores, but you have a good step one, that can help.
Hmm.
It can cover some red flags, but it can't cover all of them.
Right. Right. And so you do your first 2 years, and then you take this test, and then that just
Hmm.
helps you decide for your first didactic years, basically, and
Yep.
then to the clinical side for the following 2 years. Take a test, and
Hmm.
that can help decide if you're going to specialize into something that maybe is a little bit more competitive than other things.
So yeah, step one determine the first after the first 2 years. It's kind of ironic, but that first test will tell you a lot. Even if you think you want to do orthopedics and you score poorly on that test, you're not going to do likely not going to do orthopedics.
Yeah, yeah, yeah.
um, so you take the test after the clinical years. So then you do a year of your third year, which is the clinical year. You do that, and you take another exam after that third. Usually, most people after the third clinical year, and that focuses more on clinical medicine. So the
Hmm.
stuff you've been learning in clinic, you'll get tested on. It has some, physiology and all that kind of stuff, but less than step one.
Hmm.
Um, so that is, there's been a shift. They're all graded. When I went through, they were all graded on a 3 point
Hmm.
scale. Since I've graduated and moved on and into residency and fellowship, they have now made step one pass fail.
Oh,
So
wow.
you don't get a score anymore. So the programs can't use it as like a barometer. They just know that you passed or you failed. If you failed, obviously that's a barometer. They don't likely you're not going to get accepted. But if you passed, they don't know where on that spectrum you have fallen. You could have been in the 95th percentile or just above failing. They have no clue. As far as I understand, I don't know if maybe the candidates get like a score themselves, but the program
Yeah,
doesn't
yeah.
see it.
So if you fail, what do you like? What happens? I don't know if you know the answer to that.
So I mean, nothing happens. You can retake it,
Okay.
but it looks very bad if it takes you multiple attempts to pass the exam.
Uh,
Programs won't look. Your options will be very limited. If you get
gotcha.
in my experience, if you get in, it's going to be at a program that's less than ideal. So it's going to have a
Mhm.
whole bunch of red flags, but you really don't have a choice because
Right.
of your resume.
Right. Right.
Um,
And I'm sure you make the best of that. It doesn't
yeah, most
necessarily,
people usually do. Yeah,
because it's all about what you're going to put into it. Maybe you don't
yeah,
pass and you put more into it. I don't
yeah.
know. Yeah, if you're a bad test taker or something, they exist. So
They do. Yeah, a lot of people have. And you're not. You've never taken. I mean, the MCAT, I guess, but the
hmm
MCAT doesn't compare to the STEP
yeah,
exams. So you've never taken an exam, one like this, two that has this much importance on your future.
real life. Yeah.
So there's a lot of people that find out their scores, and you can tell they either did better than they thought, or the opposite, where they're like you can tell they didn't do as well as they wanted to.
Mm,
Um,
it's tough.
yeah. So then when you take step one, do the clinical, then you take step two. But what I was saying is when I went through step two it's not that important as long as you don't go in the wrong direction, meaning you don't score significantly lower on step two than you did step one.
Mm,
Um, Now, with step one being pass fail, the importance has been shifted to step two. So
mm,
some programs I think I've heard from the medical students that come through that I've
mhm.
talked to that you have to take step two before you can even apply.
Wow.
So they've already shifted the focus onto step two.
Mm,
Um, so then you take that, assuming you do well, whatever.
mhm.
And then the last one, there's another one, step three, but you don't take that until you get into residency. So there's
Oh,
two board exams in medical school
man.
on top of all the other countless quizzes and tests you had to take along the way.
Yeah.
Um,
They're
so
just
that's
trying to
why,
weed you out. They're just trying to.
yeah, that's why doctors get angry when people come in and they're like, "Oh, I looked at Google, for
Hmm
like no disrespect, but you like looked at Google for 30 minutes and like
hmm
we've been tested a million times on this stuff.
Right.
As long as it's within our field. If you're asking us something that's not in our field, then there's likely you do know more.
Yeah.
But if you're coming to me about a radiology question, you're not going to know as much as I know,
For sure.
having done, what, I'm 6 years now. So,
Yeah. Yeah. And and now even and so all these testings. I think I've talked to you before, and you said medical school did not get you ready for to
mm,
be a radiologist. You're like
yeah.
medical
So,
school, nothing to do with me
yeah,
becoming some.
radiology is unique at a lot of schools. A lot of schools don't prepare you to do radiology,
Hmm
um, just because a lot of people don't know how to do radiology outside of radiology. So if you don't get a radiologist to teach your medical school, then good luck.
hmm
Um, and it's also not important because I don't know how many kids I graduated with, but only six of us went in to radiology
Oh,
out
wow.
of maybe a couple hundred. Like it's not very common. So
Yeah.
you can't really uh, cater to the few. You have to cater to the many.
hmm
Um,
Makes sense.
so medical school is largely designed for people that will end up in general practice, so like family medicine or internal medicine, peds, OB. It's largely geared towards them.
hmm
It's less geared towards people that want to do what I did,
hmm
anesthesia, any kind of surgical subspecialty is not really taught about in
Medical
medical
school.
school. So
Yeah.
it's largely, at least American medical school is catered to people that want to end up in general practice, which is for a reason, right? They're more important than we are. Like frankly,
For
there's a
the
huge
masses.
shortage.
Masses.
Yeah,
Yeah. Yeah.
hmm there's a huge shortage of them. So
hmm
there's a
Makes
shortage of doctors in general, but
for sure. Yeah. And I mean,
so.
and I know I'm bouncing around even a little more, but I've worked with radiology assistants before
Mhm.
that I think I've only worked with one radiology assistant before, but that was the person that was kind of similar to a PA that was doing radiology procedures. And so I
Yeah,
never,
they're radiology specific,
hmm
whereas a PA is not radiology specific.
right, right, right.
PAs are actually PAs do the same, similar training to what we do. They do
hmm
the first 2 years for PAs is the same as it is for us. Where they differ is the second 2 years. They don't do as much clinical as we
Gotcha.
do, and then they don't have to do residency or
Right.
fellowship.
Right.
So
Right. Right.
I think they can, but they don't have to.
Right. And so you guys are very, and then I mean, and even from that, you guys from radiology, and then you specialize even more. And I mean, I guess we'll get into that probably in another episode after we get through.
Hmm.
We still got to get through your residency and then
Yeah,
your fellowship, and then why you try, how do you specialize while you're in. I don't know if
yeah,
you choose. I don't know if you choose to specialize in residency. I don't know if we won't tell too much about that. I guess stuff I'm also kind of learning along the way. I don't
yeah,
know a lot of these things that Gage has been through, so it's kind of interesting for us all to learn.
yeah. I mean, medical school is a unique. I did not enjoy medical school in terms of the school itself. It's also very. I mean, you've been around enough doctors, you know how they are. So it
Mhm.
can be very. What's the word? I guess competitive is the word you would use, but these
Yeah,
people are built different, a lot of them, and they
yeah,
don't
yeah.
really care. So it gets very hyper aggressive, hyper competitive when it comes to these taking these quizzes and all this
Right.
kind of stuff.
You
Um,
know, I think you compared it best when you said sports. I mean, you get into this thing, and
mhm,
you're trying. I'm
yeah,
trying to, and force my will onto everybody, and
yeah,
you're looking at these people as they're going through the same thing, but you're competing against each other. I'm trying
yeah,
to get a better score than you to get where I want to go, and you're trying to do the same thing for me. And so they're trying to get some sort of a competitive edge, or I'm sure that's. And then you have all these Type A personalities,
hmm,
um, and there's this, I think, old adage of how different nurses are compared to doctors. And I know nurses are competing as well through what they're doing, and everybody has their own competition, especially in healthcare.
hmm,
Everybody has to compete for their jobs, or schooling wise. But doctors, yeah, they're super focused, and they're constantly learning, and they're being constantly being tested, and they're probably constantly
hmm,
stressed out, and you're lacking sleep, and
yeah,
and then
yeah. It's
yeah,
you
like
do get tested a lot. Yeah, there were nights. If you're a good studier, you'll break it up, over
mhm,
time. No, most people were. I vividly remember staying up all night, just countless times,
yeah,
studying for because
right,
we had block exams, so we were tested on every subject at once. Some schools that you'll get tested on anatomy, then physiology, but we had all ours at one time. So you're
wow.
trying to cram all this information, and it was the first time I was ever trying to learn information long term
Mm,
because I wasn't. This wasn't like in college. I knew I could just forget this because
yep,
I wasn't going to specialize in biology. I just
right,
had to remember it for the exam. Boom,
right,
it's gone.
yeah, yeah,
Um, but in medical school, you can't do that. You're trying to remember this stuff for the long term.
right, right,
Um, and it was the first time I'd ever had to do that.
right. Which,
So,
which I'm
but
sure is incredibly difficult for a lot of. I mean, you guys are being a doctor. You're very smart, obviously.
hmm,
You're usually the some of the top performers of schools that you're coming from, and so to then having to be able to have to retain information. You don't have to just memorize it for the test, and you're like, okay, I don't need to
yeah,
retain this. Now you're like, okay, I need to remember this for
yep,
forever if I can. I mean, this is
yeah,
all beneficial, working towards what you want. Um, and so I'm sure that's unique. Um,
yeah. And that's the first time you get exposed to patients, right? Because most of us, like you have standardized patients, but sometimes you had to go out and see like real patients during even the preclinical or the clinical preclinical years. You had to go see standardized patients. Sometimes you had to go see real patients. Then you get the third and fourth year, and you have at least a baseline knowledge academically, but you have no clue what you're doing clinically.
mm,
You can practice a physical exam and all this other stuff that you want to in medical school in the preclinical years, but it's a different story when you're actually like it's a live person and you have to listen to your first heartbeat, and then
right,
you have to get the history, do the exam, and then you have to go tell someone, the resident or the attending that's
mm,
above you,
right.
and knowing they're going to repeat the exact same thing and they're probably going to find stuff that you didn't find.
Yeah,
So you
that's
have to get
that's.
used to being wrong
Mhm.
and kind of embarrassed
Yeah,
very
yeah,
quickly.
right. And I think this is something you're going to even touch on more in residency. I can remember certain doctors really
Yeah.
pushing you and making you feel like you don't know what you're talking
Yeah,
about, or
yeah,
you're inferior, or you're,
yeah,
and everybody reacts to those situations differently. And
yeah,
some people fold, and then some people it pushes them to be better.
yeah.
And so I'm sure that's a whole host of other
I mean,
things
it's
that,
just something you have because even now, as a fellow, I'm
mhm,
a pseudo attending, right? I'm
yeah,
6 weeks away from being the only name at the bottom of the report, and I'm still like, you
hmm,
still make mistakes. I watch people that have been doing this for 30, 35 years still make mistakes. They miss things.
hmm,
Um, so that was something that I had to get used to more so in residency than medical school, but it's
right,
something that doctors have to get used to, and it's something that's hard to explain to a patient, a non-medical patient, that like we're going to make mistakes,
right,
and
yeah,
unfortunately, sometimes it's going to cost lives and it's going to harm people,
right,
which hopefully it wasn't done on purpose or whatever,
yeah,
that
yeah,
kind of stuff, but it's going to happen.
right,
But I feel like I was just talking with my attending this morning about, I think I'm going to sound like a typical doctor here, but some patients have kind of the expectations are unrealistic when it comes to doctors.
mm-hmm,
Like no one expects you as a tech to be perfect,
right,
right? You're going to make mistakes, but when it comes to the doctors specifically, they think, "Oh man, you guys should never make mistakes. You should be perfect." Yada yada yada.
yeah,
That's not how it works.
it's tough. And I think, yeah, I think, and not working in the healthcare profession, is like not in that industry. I think as a person, other
Hmm.
people that I talk to, you say, they trust their doctor.
Yeah,
You forget sometimes that, like, doctors have hard days, doctors have
yeah,
families, doctors
yeah.
go through life things, and
Hmm.
or they're tired, or kids are stay up too late, or
Yeah,
things like that, and you make a little mistake, or you do something here.
yeah,
No one's perfect, and like you said,
yeah,
we're trying to, or you guys are trying to not make those mistakes. Like, we're all trying to not
yeah.
make mistakes,
Hmm.
but things happen, and
Yeah,
you hope that if it's a little mistake and it's caught somewhere, or
yeah.
whatever that is, because you guys, everybody takes that oath, do no harm.
Hmm.
And so I
Yeah.
think, uh,
And radiology is kind of, well, again, we're getting kind of ahead of ourselves, but radiology is unique in that most people don't know we exist, right? So if you get a X, maybe ultrasound because they see you and you're like, oh, I'm going to go talk to the radiologist about this, whatever. But especially if you get like an X-ray or an MRI, they never see us.
mhm,
So I assume that a lot of people assume the person that tells them the results is the one that the patient thinks read the scan,
mm,
right? So
right,
if a surgeon tells the patient the results, he may have read the scan, but
mm,
my name was on the report.
right,
If family medicine, like they may tell you, hey, your DEXA shows that you have osteoporosis, but I
mm,
was the one
yeah,
that said, hey, you have osteoporosis.
right,
Or if you have stage 4 cancer, likely I was the one that said, hey, you have Mets here, 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 and here.
right,
Um,
right,
so we exist in the dark, and I think most of us are okay with that. But
yeah,
it's hard to explain what radiology does because most people don't know we
right.
exist.
And I think even sometimes that I feel like, some doctors that order the exams, or nurse practitioners, PAs,
Hmm.
um, I feel like sometimes they leave certain portions out of not, I don't know, if
Hmm.
not telling the patient,
Yeah,
um, whatever it is, they have gallstones. And so they say, yes, you have gallstones, or yes, you have this, but we didn't tell you had a kidney cyst. It wasn't really
hmm,
relevant for me to tell you, not a big deal. But,
yeah,
I feel like a lot
yeah,
of times I'll be like, oh, okay, I looked at your last study, and we're just kind of following up a kidney cyst. And they're like, I didn't know I had cysts, or I didn't know.
yeah,
It's not a big deal. But I feel like the doctors who, or nurses, or whomever orders these exams, sometimes they leave little bits and pieces out
yeah,
that's in the radiologist's report.
yeah,
Um, so I think if anybody's listening to this, I think it's beneficial for, and I think I try to tell all my patients that I get to see, request your reports. Um, look over the reports yourself. That's your medical record. This is your history. This is your life. It's great to always, trust your doctor if you believe in your doctor. But I think, reading, looking at your own reports and having
yeah,
those on file, even if you move somewhere else, if you
yeah,
go from state to state, I think it's, and you want to say, okay, here's my documentation from wherever I was at prior. I think having those things are super important.
yeah.
Um, and just in my opinion.